My name is Anita Bosire. I am a nurse and a practicing midwife at Kenyatta University, teaching research in referral hospital. Being a midwife is very refreshing and it can be very exhausting at the same time. Every day as colleagues, we make sure we work as a team, we come together, we work as a triad. Midwives don't work alone. We work in conjunction with medical officers and our obstetricians and gynecologists who are usually on call round the clock. So we work as a team. Most of the times, as it is assumed or believed, nurses run the code. They give instructions on how you're going to resuscitate a patient, what medication you're going to give at what time, the amount of milligrams, and when to stop. We carry the weight of ensuring that we do as much as possible to stabilize the patient or resuscitate. Some say shocking the patient, it's called defibrillation. When that time comes, nurses make the call. And we spend time with the patients, I think, the longest, and we know which drug works at what time, what side effects to be expected. So we also kind of do a lot of prescription together with doctors in consultation with them. But the highlight is we do our best to make sure patients make it, patients survive, they get the care that they need in acute and emergency cases. To all nurses out there and the team on the ground with me at Kenyatta University teaching research in referral hospital, happy International Nurses Week, and let us celebrate this week together.
Hello everyone, my name is Karanja Teresia. I'm a neonatal nurse working here at Kenyatta University teaching referral and research hospital in the intensive care unit. A neonatal nurse is a nurse who takes care of the babies who are born before time, or commonly known as preterms. The babies who experience complications during or after delivery, and also those babies who require mechanical ventilation, oxygen support, and those born with congenital abnormalities. A typical day in a neonatal nurse starts in the morning, whereby we come and receive our reports from the night shift team. And also we start by preparing ourselves depending on the baby's condition. Each baby has their tailored course of action or course of management. Our babies have feeding timings and also medication timings, of which is specific for babies. There are those who require hourly feedings, there are those who require 3 hourly feedings and also 2 hourly feedings. And there are also those ones that require what we refer to as TPNs or IV fluids. Sometimes it feels very difficult because it's a very fragile population, but also it's a blessing knowing that you are taking care of the tiniest population that we have. To my fellow nurses, you are all heroes. To my fellow neonatal nurses, may you continue taking care of these tiny angels, and each day feel appreciated, feel loved. You bring a smile to each mother that walks out of your unit. So happy International Nurses Week to every nurse out there. You are loved and you are appreciated.
Hello, this is Michael Omondi, one of the nursing officers in Kenyatta University Teaching and Referral Hospital. Welcome to our surgical unit. This is one of the units in surgical unit section, which is Lily Ward. In a typical day, we normally receive patients, and once we've received the detailed information about how patients spent their night, we walked in and see each one of them, counter-check the information, and also get the care that the patient may need. Normally, we always serve patients who have come for different procedures, and we prepare them accordingly based on the procedures the patients are going for. Once the procedures are done in theater, the theater team normally hand back over the patient to us, and we take care of them post-operatively. After that, we always get the feedback of the patient every day, and we always have our patient feedback box, which normally help us to improve the quality of care of our patient here in KU Referral Hospital. The patient outcome is always excellent, and out of that we receive high number of patients that normally come in with sad faces, crying based on their conditions, but we see them walk out of our gate smiling, and this has brought a lot of encouragement to us in the work that we do. In this Nurses Week, our theme is Nurses Power, and in our power we've realized that we can advocate for patients, educate them, and also coordinate their care with the multidisciplinary team that we have here in Kenyatta University Teaching and Referral Hospital. To my colleagues outside there and those I'm working with, I would love to encourage you that every day when you come to shift, normally work with that patient and bring the best that can come out of that patient. I wish you enjoyable nursing week.
These eyes have seen the first light of recovery and the toughest nights of a medical crisis. In the female ward, we carry the stories of the women of Kenya. Working in a major referral facility means we are managing complex cases, and therefore, 1 minute I could be managing a complicated medical case, the other minute I'm participating in a research-led protocol that will change how we treat our patients across Kenya. It is a high stakes, but the reward, nothing is more satisfying than seeing these patients walk back to their loved ones with restored health. As we celebrate the Nurses Week at the Kenyatta University Teaching, Referral and Research Hospital, I am proud to celebrate with my colleagues in the female ward and all the entire departments. We are the backbone of healthcare. Happy Nurses Week to all the nurses.
Hello, good people. My name is Ruth Njambi. I am a nurse and I work at Kenyatta University Teaching, Research and Referral Hospital. I work in the surgical ward, and in the surgical ward we take care of patients pre-operatively, that is before a procedure, and post-operatively, that is after a surgical procedure. One of my best moments here is when we always work as a team. My colleagues are always determined to give quality patient care, and once we collaborate together, it makes everything easier for us. I would like to tell my colleagues out here and to all my nurses here, not all heroes wear capes, some wear scrubs, and they work with compassion. Happy International Nurses Week to you all out here.
My name is Mary Nyakio Maura, an oncology nurse working in the outpatient department of oncology, where we administer chemotherapies every day in the Kenyatta University Teaching, Research and Referral Hospital. An oncology nurse is a nurse who is specialized to deal with oncology patients while administering chemotherapy to them and also planning their radiotherapy sessions. My typical day as an oncology nurse is basically welcoming the patients into the room, doing a quick assessment of anyone who may need special needs. We put cannulas in them, and some have chemopods, so we use them to basically hydrate these patients before we prepare them for chemotherapy. After we hydrate these patients, then chemo is prepared, and then we administer chemo. After chemo, we observe whether there are any side effects, and then we post-hydrate these patients and later discharge them home. We treat a variety of cancers here, almost all of them, inclusive breast cancer, prostate cancer, cervical cancer, colon cancer, stomach cancers, and also blood cancers. There is hope for cancer patients, especially when they accept their treatments and they receive family support, and we are able to monitor them even after giving treatments, and we are able to follow them up maybe in a span of 3 to 6 months. A cancer diagnosis is not the end. There is hope after a cancer diagnosis. What we do here, chemotherapy administrations, if the cancer is found really early, then the surgeries, we find patients doing really well, and with the support of their families, they are able to have quality of life. This being Nurses Week, I want to appreciate all the nurses out there. You are doing a really good job, and keep doing the good work you're doing. Happy International Nurses Week 2026. Keep doing the good work you're doing.
My name is Rael Keter, a nurse working in Comprehensive Breast Care Center at KUTRRH. As we celebrate International Nurses Week, I would like to take you through a role of a nurse in breast care center. Number one, we start with triaging of patients, that is taking vital signs for any patient that come in, both patients who have already diagnostic cancer or non-cancer. So the first thing we do also is help patients do self-exam breast examinations. That is to help patients detect early detection of any cancer issue. We also help doctors with procedures such as biopsies, and also help doctors as they prepare patients for surgical procedures. That is, advocate for patients, help them to have an informed decision before the surgery. Another role we do is also take care of those patients who've undergone surgery, including monitoring their wound, also help them as they go back to their rehabilitation. We also do prepare patients for breast ultrasound and also mammogram. My message to patients outside there is kindly visit our center so that you can be early detected and also help us to prevent cancer in future. We also want to tell other patients that it is good to visit our center so that you learn how to do self-breast exam, so that it will help you to detect and monitor any early symptoms. And I would like to wish my colleagues Happy International Nurses Week.
My name is Christine Kinanu Munywa. I work in oncology inpatient ward, that is Orchid Sunflower. Behind the doors of Orchid Sunflower, that is in our inpatient ward, we do not only give medicine, we administer chemotherapy, we handle side effects of chemotherapy, and also handle severe symptoms of chemotherapy. We coordinate with doctors, palliative team, and nutrition team to ensure that our patients get holistically care that they deserve. We offer emotional support, spiritual, and give hand to our patients to ensure that they are not alone in this journey. I've seen patients come in, get diagnosed with cancer. They go through the process of chemotherapy, go home, get healed, and live a normal life. They come back always thanking us. To my fellow nurses, I stand with you this Nurses Week for always showing up in your shift and with compassion, courage, and skills in ensuring that our patients receive the best care. Happy International Nurses Week.
My name is Purity Washira. I serve as the nurse in charge, Integrated Molecular Imaging Center at Kenyatta University Teaching, Referral and Research Hospital. We call it IMIC in short. At IMIC, we offer a wide range of services to include PET scans, SPECT imaging, and theranostics. These services play a major role in diagnosis, treating and monitoring of patient conditions, especially in cancer care. My role as a nurse goes beyond clinical practice. I strive to ensure my patients are comfortable, well taken care of, and educated. I also ensure safety during the procedures, especially because of radiation. I also offer emotional support during this very exhausting and emotional journey for our patients. Working with a team, a multidisciplinary team that blends science, innovation, and compassion has been a big privilege. My best moment as a nurse working at IMIC is watching our patients come back through our doors smiling, healing, and grateful. This reminds me why what we do as nurses is impactful to our patients. And of course, my other best moment is continuing to watch IMIC grow as a center of excellence in cancer care. As we celebrate International Nurses Week, I salute all the nurses for their dedication, compassion, and resilience, because behind every patient cared for was a nurse that chose to show up even on the hardest days. Happy International Nurses Week 2026. May we continue to serve and make a difference one patient at a time.
I really want to appreciate all the nurses in KUTRRH. This hospital is known largely for the excellent nursing care that is given by each one of you. I, as the Director of Nursing Services, want to really appreciate your levels of resilience, your level of professionalism, and to thank you for the time that you put to ensure that our patients remain safe as we deliver excellent quality care. Okay. And I'll pass my love to all of you. And to the nurses in Kenya, I want to also appreciate each one of you for everything that you do for the Kenyan population. We appreciate not everyone can come to KUTRRH, and wherever you are, you're doing a good job. Let's keep doing this, and I believe it shall also come back to us.
Nurses are, the cog in the wheel of providing healthcare services. Most of the time, even in the lower facilities, they are the first contact of patients. They're the people who first find the patients, triage them, and pass on them on to the doctors for, the diagnosis and treatment. I want to tell our nursing staff that they are the heartbeat of our KUTRH, but also for all the facilities that are out there. I also want to reiterate that the services you provide is what makes sure that our patients either get positive or negative outcomes. So I want to encourage them to continue providing the care, to continue attending to patients, and to know they actually matter. They are seen, they are important, and that they are critical for us to achieve universal health care as a country.